Today, I'm going to discuss another question from UWorld that a 45-year-old man was shown to have a blood pressure of 142 to 90 mmHg at a health fair. Despite modifying his lifestyle, his blood pressure remains elevated in the two separate subsequent occasions. He was prescribed an antihypertensive medication. After 3 weeks, the swelling of the lips, which shown in the accompanying photograph, was observed. What is the most likely cause of this finding? So, if we see the patient's lip, as they already said that there is a swelling around the lips. So they want to ask that what would be the side effect of the antihypertensive medication, or what would be the metabolite, or what would be the factor that cause the edema around the lips. So they want us to tell the exact cause and give the name of the drug that cause the side effect. So first you understand that this is a condition of angioedema where there is increased extracellular fluid. The fluid comes from the blood vessel out into the interstitium, and there is a swelling. So what is the cause, or why the fluid come out? Whenever there will be increase in hydrostatic pressure into the blood vessels, the fluid come out. Or whenever there will be the vasodilation, a severe vasodilation, which also leads to the fluid to come out from the vessels and accumulate into the interstitium. And increasing in permeability of the vessels causes the fluid to ooze out and leak out from the vessels. So we will go one by one options and we'll see that which drug causes this condition. So if you talk about the verapamil, it is a calcium channel blocker, and the common side of verapamil is hyperprolactinemia. It doesn't cause a severe increase in increase in the diameter of the vessel, or it doesn't cause increase in permeability. If you talk about amlodipine, it is also a calcium channel blocker, and the common side effect of the amlodipine is peripheral edema, constipation, and gingival hyperplasia. And if you talk about the option C, that the option C is lisinopril, and it is a class of angiotensin converting enzyme inhibitor. So if you know the mechanism of action of the angiotensin converting enzyme inhibitors, they inhibit the angiotensin converting enzyme. The angiotensin converting enzyme, once it block, it cannot convert the angiotensin 1 into angiotensin 2, and this way it help in decreasing the blood pressure of the patient. It also causes the increase in level of the bradykinin. Why? Because the angiotensin converting enzyme is not only convert angiotensin 1 to angiotensin 2, it also help in the degradation of the bradykinin. So once there will be blockage of the angiotensin converting enzyme, there will be no degradation of the bradykinin. Once there will be no degradation of the bradykinin, so definitely there will increase in the amount of the bradykinin. So once the level of the bradykinin increases, definitely the more receptors occupied by the bradykinin, it acts on the beta 2 receptor and causes the vasodilation as well as increasing the permeability. So amlodipine is also a drug causing the vasodilation by relaxing the smooth muscles by inhibiting the calcium channels. But here there is no permeability increase. But in case of lisinopril, due to the bradykinin, there is increase in permeability as well as the vasodilation. So this causes the fluid to ooze out, to leak out, and this condition is angioedema, and the common side effect is the angioedema. And the angioedema starts mostly from the facial region, because there the skins are loose and they're not so tight, so it's appear on the facial region, on the face, the lips and tongue. So option D is the hydrochlorothiazide. The common side effect of this thiazide drug is hyperglycemia, hyperuricemia, and hypercalcemia. That's why it cause gout in patients of hypertensive patients, okay, taking the drug for a long period of time. And if you talk about the option E, it is a loop diuretic, a furosemide. And the common side effect of the furosemide, they are hypokalemia, ototoxicity, allergy, and interstitial nephritis. So you understand that the drug which causing this angioedema is a C inhibitor, and that is the option C, the lisinopril. So the symptoms appear within minutes and resolves within for 24 to 72 hours of discontinuation of the drug. So the answer is C.